And we are live. Hi, good evening, everyone. Welcome to Level Up Live. I am Dr. Sharita Gaskins-Tillett. I am your host. This is Level Up Live, the show where we showcase the amazing accomplishments of women physicians, both inside and outside of the exam room. I am super excited about tonight's guest and about the conversation we're going to have. I just want to allow a few minutes for folks to come in. If you're joining us live, please say hello in the comments. Please put your questions in the comments. If you're watching the replay, hashtag replay. And I still invite you to leave your questions because I think you're going to have some questions for our guest, and I'll be happy to pass those on to her so that you can get them answered. And I just want to make sure I did not wish you all a happy Thanksgiving. I just wanted to say happy Thanksgiving. I hope you had a wonderful weekend with family and friends and are enjoying the holiday season as it starts to ramp up into full swing. So I'm going to introduce our guest this evening. I have joining me tonight Dr. Sarah Nasir. She is a dual board certified family medicine physician subspecializing in addiction medicine. She's an alumna of UC Davis and majored in biological systems engineering, later pursuing her passion for medicine at the West Virginia School of Osteopathic Medicine. Dr. Nasir's dedication took her to UCSF Fresno for her family medicine internship, concluding her residency at Ono Ogden Family Medicine Residency Program in New York. Her commitment to underserved communities is notable. Having served in DC's community clinics and homeless shelters predominantly within the marginalized African American community, she delved deep into addiction treatment while fulfilling the National Health Service Core Service requirements. The mission continued in Santa Barbara, California, where she extended her expertise to the underserved, including the underprivileged, immigrants, and undocumented populations, providing both primary care and addiction medicine. Currently, as the medical director at the local methadone clinic, Dr. Sarah specializes in treating patients with opioid addiction while offering remote services to other California branches of her organization. Beyond her clinical roles, she is a fervent advocate for holistic health solutions and founder of several holistic well-being focused startups, including TripTV, Transcendent You, and the nonprofit Pacific Oasis Foundation. As a certified life, spirit, business, and health coach, Dr. Sarah's approach is both clinically profound and empathetically broad, making her a beacon of hope for many in the realms of recovery and treatment. Good evening and welcome, Dr. Sarah. How are you?
Hi, Dr. Sharita Gaskins. Thank you so much for having me. I'm doing well, and I'm really excited to be here and sharing information about the field of addiction with the audience today.
Well, thank you so much for coming. This is a really big problem, here in our country. And, I applaud you for the work that you do and thank you, for your
Thank you.
contributions to the field. And so I usually like to start, so there's a lot for us to talk about. So let's start there. But I
Okay.
usually like to back up and have you kind of take us on, tell us about your journey through medicine. Did you always want to be a physician? And then how did you come to choose addiction medicine specifically?
Yeah, that's definitely a very deep question. I actually started out wanting to be an astronaut when I was a little kid, and then,
Oh, wow.
um, yeah, I was told that you really don't have any humans to serve on the moon. So then it turned
Mm,
into like my mom was a physician, so I saw the difference that she was making in her community at that time. I'm from Bangladesh, so third world country, very impoverished people. So I saw the difference it made to have a woman physician, educated woman in the presence, and everybody looked up to her. And so that became my second goal in life to be.
okay.
And then when I was in college at UC Davis, choosing my major, my uncle was recommending having like engineering as a backup because, sometimes becoming a doctor doesn't work out. At that time, engineering sounded pretty good. So I went and I dived into that. Definitely picked up some critical thinking skills and other design and thinking process over there. And then when I went into medical school, the concept of the holistic osteopathic philosophy really, really drew me in And so that's basically what I focused on applying for. And thankfully, I was able to go to my alma mater for medical school, located in the beautiful, Appalachian Mountains. And so I got to see another set of rural experience. And that's actually where my first exposure to addiction started. During my third year in the rural town of Princeton, when I was doing OB rotation, I was exposed to babies having withdrawal symptoms, what we now know as neonatal abstinence syndrome. And at that time, I definitely had the usual stereotypes you have against people who are using substances. Definitely had a lot of stigma against the moms who were using while they were pregnant. And now I'm seeing a baby just being so fussy, uncomfortable in front of me. So I joined the nurses in holding a lot of grudge against the mom for doing that to herself and thus harming the baby. Then fast forwarding, in my years in residency in Elmira, New York, apparently we were sitting on a belt that went from Mexico to Canada. So along this
Oh,
drug route.
interesting. Okay.
Yeah. And so at that time, there was a lot of opioid prescriptions that were being overprescribed, and we had the pill mills happening. And my residency once again was in one of those hot spots. And so we got to see a lot of the havoc that this was causing in the community. And so that's where my interest started. And I started to have a change of mind and perception of how I approach these patients because of one attending. When I went up to him and I'm like, what is wrong with these people's moral thinking? Why can't they just stop using? And he was telling me, it's really not that easy. When you start to use, your actual brain chemistry and the actual brain itself changes. So it becomes like a disease. It's no longer just somebody who is having it's not just free will anymore.
Right. Sure. Some kind of moral failing on their
It's
part.
no longer a moral failing. It becomes an actual chronic disease. And that's where us as doctors and healthcare providers having that an extra level of understanding, sympathy, is very, very important in the recovery of this, because this is not just the physical body that's healing. There's also mental aspect, social aspect that needs to be taken into account.
Yeah. You're right. And you talked about some of the prejudices that you had earlier on. And it kind of reminds me of, I'm an OBGYN. And it reminds me when I was in practice, one of the other physicians, wanted to kind of cherry pick, if you will, pick and choose which moms we were going to drug test. Because, there's certain people who quote unquote look like they might use drugs, and then there are other people who did not. And
Yeah.
I was actually in support of universal testing. And believe it or, I mean, I'm sure you would believe this. There were many women that we discovered who were using drugs who, did not fit the typical, what the
Yeah.
stereotypical is what I'm going to say, the
Sure.
stereotypical model of, a drug addicted woman. You're talking about middle class people, who are well educated and those kinds of things. It was almost like a shock to their systems. The other doctors, a shock to their systems when these people would come back
Mhm.
positive for whatever kinds of substances.
Yeah,
So
for sure.
you're absolutely right that we do have a stigma that kind of carries with people, but we need to kind of get over that. And actually, we were talking before we came on. I was doing some research and found that 13.4% of the country, of those over the age of 12, have used illicit drugs in the last 30 days. That's a huge number.
That's a huge number.
Yeah. So
Yeah.
what are your so I guess what are your thoughts about the current climate, and how can we what should we be doing? I guess.
Um, I guess if you're looking at the medical level, I think that's the place that I'm going to speak from. What can we as providers do? Is I think what I personally went through, and you're mentioning as well, is to first ask ourselves, what are our own biases that are getting in the way of being able to connect with a person in front of us that actually needs our help? Becoming more educated and more aware of what it is that addiction looks like, because there is that acute phase, and then when it becomes like a chronic disease, some patients need some sort of chemical replacement,
Yes.
because their body itself has no longer the ability to replace it. Just like, when we have diabetes and you have insulin insensitivity to such a point that if you don't inject insulin from the outside the body,
Right.
their body's not going to function. And so starting to look at it in that way. Definitely, in regards to prevention, I think that is, how do I say it? I think that's some work that needs to be done, even more, like even maybe even at the government level to social level, where we're going into school, educating students, parents. I also have noticed, this is a personal observation. I feel like in the time that I've been growing up, the content that we have on TV has increased significantly in all other substance use other than, tobacco, because
Yeah.
we had that big tobacco fight when I was in school, where we had the Dare and Kick Butts campaign.
Yes.
But now, if you look at the amount of content in TV, in media, in movies, there's alcohol and underage drinking happening everywhere. And alcohol and tobacco are some of the legal drugs and substances that are around. So those would be some things, having alternative options for our youth to be engaged in, such as arts and sports. That would be like the first place that you start with the prevention. As you go up, some of the movements that has been happening is now doctors can actually prescribe Suboxones from their office without necessarily having to have the data waiver, which was a training you had to go through to prescribe a medicine called Suboxone, which is a really good opioid addiction treatment. And then making the education and the training for addiction medicine more available in medical school, in residency. Those would be some other good things that have been happening in the legal area is that reduced criminalization of just drug possession. It's one thing
Mhm.
if you're selling drugs, but then just to like possess a drug, because a lot of times folks are doing drugs just because they don't want to go into withdrawal, right? And it's a
Right.
very, very miserable state to be in when you're going through withdrawal. So they might
Right.
be going around looking for drugs from whoever's willing to sell them. Um, and then, there's a lot of other things like safe needle exchange. So because you see a lot of other conditions that happen with around addiction, some you might see in your practice, like the STDs, because there's some um, individuals who sell their body in exchange for having access to the drug paraphernalia. And then hepatitis C, HIV, these are also very predominant in the population when they don't have access to somebody that they feel they can trust and turn to for help.
So now, what do you say to the person who says, well, if we support them in, the safe needles, or, or making sure they have clean needles, or we support them in having these replacement medications, or whatever, that we're enabling? What do you say to people? Because I know that there are people who have that kind of sentiment about
Dr.
it.
Shreda,
Can you hear
do
me?
you mind repeating your question? It was cutting off on my end.
Oh, I'm sorry. Yes, yeah.
Now I
I
can
was
hear
just saying,
you. Yes.
yeah, what do you say to the
No
person
problem.
who says that we're enabling the addiction to continue when we're offering support, like the clean needles, or we are giving replacement medications, or treatment medications, really, like Suboxone. What do you say
For
to
the
those
needle
who say that
exchange.
we're enabling and perpetuating the problem?
I'm so
Can you hear
sorry
me?
that like cut off halfway. What I'm hearing is that you're asking, what do I say to the folks who say that, needle exchange, medication assisted treatment are basically enabling drug
Yes.
use? Is that the
Yes.
question?
That is the question.
Okay. You know, okay, excellent. So with the needle exchange, from what I've read in literature, is that it actually shows that it doesn't necessarily enable further drug use. It instead provides a safer exchange of using, because they would already be using, but rather it's cutting down the incidences and prevalence of these other diseases. As for the treatment option, you know, it's this is something I tell my patients, because a lot of them, they come with this prejudice as well, because we all don't have enough understanding of this disease process, where they think that being on a medicine like Suboxone or another medicine we use, methadone, instead of being on heroin and fentanyl, they think they're just switching one drug for another, right? And so that is a huge mindset that becomes an obstacle in actually helping patients and treating them. And it gets complicated when you have other folks around the patient, such as their family members or other healthcare providers, or if they're in a sober living facility, the counselors. These are the sources that I've heard that they have also been told that if you want to recover, you need to be off of everything, and that includes the medicines that we're prescribing them as their doctors for this disease. And so I take that time to tell them, and this is what I'm going to tell as well to those folks who have that question, if being on treatment means that they're just replacing one thing for another. This is a very highly monitored, very highly regulated field of medicine. And what we do is we give just the right amount of medicine to um, put the homeostasis in the body back, right? When folks are using on the street, they don't know what's in it. My patients'
Right.
urines they think they're doing heroin. They have done heroin all their life, so that's what they think they're doing. But it has fentanyl, it can have PCP, it can have ecstasy, it can have, God, we don't even test for all the other spices that they might be cooking up in the
Right.
backyard when they're selling it, right? So they don't know what they're getting. And they might be thinking they're doing heroin or Percocet or Norco, but instead they're getting this really, really potent fentanyl. And that's when you get the overdose. And that's
Right.
when they're dying. And so when we're doing it, we're closing the chemical gap only the amount that it needs to be done, with regular follow up, regular checkup, question, inquiry, checking the vitals, checking the withdrawal symptoms, the duration of the medicine's efficacy. And so we're only closing the gap. We're not going for the euphoria. We're
Right.
not the drug dealer in that way. We're not trying to get them hooked.
Sure.
Our goal is to stabilize them, allow the body to focus on healing, and then over time to slowly titrate them down to the lowest dose possible. For many, it means coming off of the medicine completely. And for some, it means they need to be on a dose for the rest of their lives, because their body does not have the um, other resources it needs to be able to keep them stabilized on it. So, just like diabetes or high blood pressure.
Right. And in fact, treating them, it's actually dangerous for them to try to go cold turkey, right?
Yes.
So what are some
Especially
of
depending on,
yeah, what are some of the things that you may find, in people, again, because people don't realize necessarily that it is, life threatening even to to stop these drugs, you know, like I said, cold
abruptly.
turkey. Yeah. So what are some of the
Yeah.
things that could happen in that circumstance?
Yeah, the ones that have the higher death associated with the withdrawal symptom are substances like alcohol, chronic alcohol use, and chronic benzodiazepine use. Because with the chronic alcohol, If you go cold turkey, within 4 days, you start to get the delirium tremens, which is a withdrawal seizure. And benzodiazepine activates similar receptors in the brain. So, sudden benzodiazepine cessation can also lead to withdrawal seizures. And it's the seizures that tend to kill people. As for the opioids, where it is just the pure opioids, even the fentanyl, what tends to kill is the overdose on the opioids. However, with the withdrawal symptom, if it's just pure opioid withdrawal, you don't see pure like fatality associated with it. It is just miserable, because all parts of your body system, they're just on edge. It feels like, I like to use the example of Alice falling down the rabbit hole. It just keeps falling and falling. Everything you just don't feel comfortable inside of your body. And so that is, you're alive, you're aware of what's happening. And I think that's what's also very painful.
So I'm going to shift gears a little bit just because,
Yeah.
many states now have legalized marijuana. And I'm curious, what do you think about, how do you think this will play into, the drug epidemic that we're seeing in the country as it stands? Because I've always been told that marijuana is a gateway drug. So if the gateway is now wide open, what's going to happen?
You know, I I can't say much about what's going to happen, but I do have my fears because I do agree. Like oftentimes, the younger you are exposed to substances, be it alcohol, be it tobacco, and now be it marijuana, it is bringing the youth and the kids more in touch with. Um, to be easily influenced by other harder drugs, as we say. And with the kids, their brains are still developing. If you ask the pediatrician, the neurologist, like the human brain sometimes doesn't like reach the full maturity until we're in our 20s, in our early 20s. And at this time, we're introducing all these, you know, neuron stimulating, inhibiting drugs and substances in a way that it is going to impact the way that the human's brain develops through these formative ages. And so, what does it mean? I mean, it means that potentially you're going to be more susceptible to the use of other substances. I know people say that they can just stop cold turkey whenever they want. That's one of the things that people often tell me. And when I've dealt with some pediatric population, like they're not even understanding why this is a concerning thing. So I think it's definitely risky. And the way around it is definitely coming back to how the parents are having an open communication with their children.
Yeah.
Some folks are okay with experimenting, but it's a very slippery slope.
Yes.
It's like, I don't know, like I myself don't feel comfortable venturing down the road where I know that I might slip and fall and get hurt, but there are some folks who are willing to take a bigger risk. I would say talk with your provider as well. Learn about what are the discussions you can have, because one of the things you mentioned is that addiction can happen in anybody.
Yes.
And by the time it becomes evident that somebody's under influence, it has gone on long enough that the path back tends to be really a big, hard climb.
Yes. So now tell me, what are some of the things that we as parents can look for if we're, are there some signs that we can look for in our child to see that to begin to suspect that maybe they may be experimenting?
I think the telltale signs, if it is that evident, is that they can come home having a smell that's not normal. That tends to be a giveaway. But other behavioral signs can be that the grades are slipping, or the grades aren't as good as they used to be. Behavior change in terms of attitude, anger, Are they quick to anger? Are they easy to become irritable? Are they giving up activities that they used to enjoy once? And then also, being your companionship has a huge influence on who you become at the end of the day. And so, I think it's a parent's responsibility to know where their children are going, who they're hanging out with, having a safe environment, because, the children that are doing drugs, maybe they have not a safe living condition. So if maybe it's a societal community thing that needs to happen, that we create safe spaces for our children, so even children at risk can have a place to come and get the help that they need, because it takes a village to raise a child, right? So we should be
Absolutely.
raising a village that way.
And so, in that same vein, I want to talk a little bit about vaping because that has become a huge thing. And I guess for our audience who that may not know what vaping is, can you tell us what vaping is, and then can you tell us some of the detrimental effects of vaping?
So vaping at this time is basically similar to electronic cigarettes. You put some flavored, tends to be nicotine into a device that allows you to smoke. And so, yes, you don't get all the thousands of cancer causing chemicals that you find normally in cigarettes that are done that way to make it so addicting. Um, but still, you are getting a good dose of nicotine from it. And nicotine in and of itself is substance that impacts your brain's dopamine release, serotonin release in certain ways that can become habit forming. Additionally, a lot of the different oils that they use for flavoring and stuff, when you're inhaling it, it can cause irritation in the lungs. And right before COVID started, there was this one thing that was going around where vapors were complaining of irritated lungs. They couldn't breathe. And so it was causing irritation in the lungs. So it's not just, the brain that we're concerned about.
Right.
Other parts of our bodies also get impacted.
So then how can we, again, as a society, as parents, how can we get the word out that these things are not nearly as benign as people think they are? Because I've had patients who say, "Oh, I don't smoke, I just vape." So, how do we get the word out that all of these things can have a detrimental impact on your physical health, and then can also lead to addiction and other um, mental health issues?
Yeah, I think the biggest way is to raise awareness on it. So, like how we're talking on this podcast, I think a big place where it can be impacted is getting the message out where the youth are exposed to it. So, places like the media, instead of, making substance use glamorous, instead of making it fun, because that's how it's portrayed as, is that if you want to have fun, you go to a party when your parents are out of town, or you throw a party and then everybody brings drinks around. And if you go to a rave, that's where you pop some pills. Those things get passed
Right.
around. So I think the pressure needs to be created to have that type of healthy image of what a human's body should be like, what a healthy mind looks like, because that's where our kids pick up first and foremost of definitions of what is right and what is wrong. And then in schools, continuing to educate about it. As physicians, we have those screening questions where we screen for depression, we screen for physical, sexual, emotional abuse, as well as drug abuse. So those questions are being asked for if you're not a pediatrician or a family medicine provider with access to the kids, specialists can, ask, you take care of future parents. So having that dialogue with them, because one of the things that I've seen happen in the OB setting is that the involvement of CPS, and so the young moms become very afraid of, asking for help from their OB to begin with. that to admitting that I need help. So everybody keeping an eye open for somebody who needs help and connecting them with the right resources, be it a psychiatrist, an addiction medicine specialist, where these conversations and dialogues can happen. I think communication has huge power. And so utilizing that power to connect with each other, I think will be probably the big way of tackling this.
Okay. And then I guess the next thing, how can we destigmatize this? Because again, I mentioned in practice that, I had colleagues who thought that, because you're the suburban mom, that you couldn't possibly use drugs. But we both know that that's just not true. So how do we destigmatize it so that, that we do begin to universally, screen for drug addiction, but also so that people can feel more comfortable seeking care.
Yeah. I think once again, communication, having educational programs, um, when we do the screening, like knowing how to connect the patients with the right proper help. SAMHSA, which is SAMHSA, the Society of Addiction Medicine, I think, Health Care. I'm forgetting like what the acronym stands for,
Yeah.
but they definitely have a hotline that you can ask for help. And then, you know, at even community levels, like if you have any faith affiliation, like churches, mosques, synagogues, temples, making the faith leaders aware and educated on this as well, so they can identify and connect folks with the proper help that they need, would be also a good way of helping with destigmatizing. Because I mean, definitely, addiction, folks who are addicted, there's a lot of crime that happens around it, because your judgment zone, the prefrontal cortex, where we make all these decisions, that basically gets disconnected. And that, the primitive part of our brain, where it's fueled by the basic emotions, hunger, desire, reward pathway, fear pathway, these are the ones that are active. And the body, when it's constantly feeling like I'm withdrawing, compared to when the drug is in the system, they're in like cloud nine, and now they're just 6 feet below. Like, that's a huge difference. And so they are trying to get the drugs at any cost whatsoever. And so there are things that are happening with trying to get money so they can go buy. A lot of people turn to selling as well. So they become propagators of this destructive behavior. And so also the other thing would be good is if our law enforcements are also aware of how they can handle it. So, right now, it's a big movement that's slowly happening, and I'm glad that it's happening, is that they're connecting these patients to medication-assisted treatment while they're incarcerated. So when they come out, they're not running over to their drug dealer trying to, make up for all the time that they have been missing out, feeling pain.
Yes. Well, we're almost out of time. I usually like to end on a variation of the same question. And so, if we as a society, as individuals, want to up level our compassion, our empathy, our education around addiction, what is the single best thing you think we could do?
I think education and awareness. I think that has been the theme of it, that I keep coming back to, because I think if we're all aware of how bad withdrawals look like, and how much it tears apart families,
Yes.
and as a result, like, how the society suffers, if we can see that connection, I think we will learn to stay away from it. And then if we can understand that underneath all of this is a human being who's hurting, who needs help, I think that is where compassion can come forth, like listening to their stories For example, a lot of my patients that come, they have some sort of chronic pain, undiagnosed rheumatoid arthritis, ankylosing spondylitis that can actually make a person bend. Like, the spine becomes, this autoimmune disease causes so much spinal curvature that causes a lot of pain. So when somebody does have chronic pain, helping them connect with the proper pain management treatment and disease disruption treatment, along with their dependence treatment, like treat the person for the person they are, not just the labels or the diseases that we see. I
Now,
think that was
I said I was asking the last question, but actually I'm not. I lied.
no.
Because you said something that really that I that brought back something in your history, your toolbox, so to speak. I know that you deal with like whole person, holistic, approach. What is different about what you do in terms of the way that you treat a person? Because you talked about seeing a person underneath, and so I would think it's more than just giving them medication to stop withdrawal. What other kinds of things do we, are you looking at to kind of um, treat the whole person to bring about a full state of wellness?
Yeah. So mind, body, spirit, that's the osteopathic principle. Definitely addressing any other coexisting mental health conditions that can be occurring. For example, with schizophrenia, it's very common to have polysubstance use in that condition. And so, trying to encourage patients like that to take their medicines. If you have depression, take your medicines. But medicines for some diseases are not the final answer. For schizophrenia, unfortunately, it is some medicine. For depression, it can be, cognitive behavioral therapy is a big one for depression and anxiety, and then medicine is the second level treatment for it. So take care of those. And then having us, making sure that your spirit is healthy. So if somebody has a faith that they ascribe to, make sure that you're connected and drawing from that energy, as well as fueling your spirit with good social support, being involved in volunteering in community service, being employed,
Yeah,
going to a place where you're seeing people, you have connection, because we humans we thrive on good connection. It lifts us up.
yeah,
Stay away from the negative connections that pull you down. And then motivation in life. I tell my patients, what is the sun in your horizon? Because
mm,
I think that is the big thing, that if you have it, if you know where you want to go, eventually all the storms will calm down, and the sun always comes up eventually. So if you know where you're going, have that big goal. If is it your children, is it a degree, is it some amount of dollars, or is it a nice car, is it whatever it is. A lot of folks lose the sun in their horizon because they get caught up in this storm. I like to lead with that for my patients.
that's beautiful. I like that. So tell us, if someone's interested in working with you, how can they do that? How can they find you?
Yeah. So for now, the best way to reach me is, if you're trying to work with me, I'm interested in raising awareness and giving more education on the addiction aspect. If you're somebody who's trying to find the sun in the horizon and work towards it, I think the coaching service is probably one way to get through it. You can always email me at saranasirdo@gmail.com. That's one of my email accesses. And then with if you need help at the methadone clinic in Santa Barbara, that's another place to find me. But for folks outside of Santa Barbara, California, I think the coaching and the speaking engagements are the best way to get me for now. And then hopefully in the future, I have some things coming.
Excellent. Well, we will make sure to put all that contact information in the comment section. But thank you
Thank you.
so much for coming on tonight. Again, thank you for the work that you do and the education you provide, the awareness that you bring, because, as I said at the outset of this conversation, this is a huge, huge, huge issue. And,
Yeah,
I think we've only crack the surface of it
sure.
as a society. There's so much work to be done and so much so much education that we need to do and kind of undo, undo some things here. But thank you for the conversation and thank you for the work that you do. I really appreciate it.
Yeah, and thank you for the opportunity to allow me to speak and educate. And thank you as well for the work that you do, because without having this platform, somebody might not have heard this discussion and become more aware. Thank you.
All right. Well, that's it. Thank you guys for joining us tonight. Again, if you're watching the replay, hashtag replay, definitely put your questions in the comments section. The other thing I would ask, this is a really important episode. I would ask that you share this episode with family and friends, and maybe teenagers and other people who you think could benefit from gaining more awareness around addiction and some of the things that it is and some of the things that it isn't. So thank you again for joining us, and we will see you uh, next time. We're actually going to be off for a couple of weeks. We have some changes in the works that I'll share at a later time, but we will probably be off for at least the next 2 weeks. And then we will be back in a different format. So that's all I'm going to say for now. Take care. Have a great night and a great week. Thanks again, Dr. Sarah.
Thank you, Dr. Sharita. Bye.